And the last class of lipids that we'll talk about in this class is the fat-soluble vitamins. Overall, there are two things you need to know about the fat-soluble vitamins. Number one, they are fat-soluble, and number two, they are vitamins. The fat-soluble vitamins have very different structures, and they have very different purposes. But the major thing that is common about them is that they are soluble in fat, and of course that they're used as vitamins. The four fat-soluble vitamins are A, D, E, and K. Vitamin A is probably most known for its benefits to vision and to the skin. Vitamin D is most known for the benefit of strengthening the bones, and interestingly can be formed in the body when it is out in the sun, and that's why you're expected to go out to the sun a little bit every day. Vitamin E is often known because of its benefits to the immune system. It's also good for the skin and is often used in anti-scarring medications. Vitamin K is especially known for its ability to help with blood clotting and bone health. All of these vitamins come from common vegetables, nuts, and legumes. Vitamin A also goes by the name retinol, and it is made out of many plant pigments, especially things that are yellow and orange, which is why carrots are considered one of the best sources of vitamin A. Several of the vitamins are considered terpenes, which means that they're made out of an isoprene unit. And here I'm going to show you what an isoprene looks like. It's going to have 4 carbons in a chain, plus on one of the positions it's going to have a double bond, and coming off of that double bond will be a methyl group. That structure has the common name isoprene. And here we can see those isoprenes. So counting 1, 2, 3, 4, and then again 1, 2, 3, 4, and again 1, 2, 3, 4, and finally 1, 2, 3, 4. You can see how there's several of these groups in here. An interesting side note about the isoprene unit is that it is found in a very water-insoluble substance that we call isoprene rubber. Isoprene rubber is what is found in wetsuit material. So wetsuit material, its job is to keep water out, and these isoprene units do a great job at keeping water out because they are very fat soluble and water insoluble. Some of the signs of vitamin A deficiency are night blindness, very, very dry skin, fatigue, and problems with smell. And that's because the membranes have gotten dried out, so the chemicals that cause those smells don't stick to the membrane, instead they pass through. Unlike the water-soluble vitamins, the fat-soluble vitamins can allow you to overdose on them. Because the vitamin is stored in the fat, rather than being excreted directly through the urine, this can be stored up, and so you can overdose on the fat-soluble vitamins. So what does it look like if you have too much vitamin A? Well, vitamin A stores up calcium, and so you might have too much calcium in your body, which can cause dry skin and rashes. It can also cause the hair loss, vision loss, and in some cases mouth ulcers, as you see here. It's fairly difficult to get too much vitamin A by eating it. Generally, this will happen through somebody taking too many multivitamins for way too long. You can also see that vitamin D has these isoprene units with lots of methyl branches coming off. It's a quick way to identify it. As a reminder, you will not be asked to identify isoprene units in the vitamins. You only need to know that they are fat-soluble vitamins. One source of vitamin D is, of course, the sun, and using cholesterol, the body will convert it to vitamin D. Other food sources are cheese, margarine, butter, milks, and some fatty fishes. There are also a variety of foods that are vegan foods that contain vitamin D, including soy products, oats, beans, nuts, broccoli, and other such things. Some symptoms of vitamin D deficiency are bone loss, hair loss, muscle pain, depression, high blood pressure, heart attacks, and an increased risk of breast cancer. Vitamin D deficiency is very difficult to spot, and it is hidden quite often. It can cause mood changes, muscle cramps, fatigue, eventually bone loss, and some bone and joint pain. Again, very difficult to spot because these are common symptoms for many, many different things. As with the other fat-soluble vitamins, you can overdose on vitamin D. In this case, it will often cause nausea and stomach problems, sometimes confusion. It may cause you to urinate much more often, and it does tend to cause fatigue. And again, it is rare that you can overdose on vitamin D from your normal food sources, but if you take too many vitamin D supplements, it can be an issue. Vitamin E is actually a mixture of a lot of different tocopherols. Notice that it ends with OL. This tells us that it's an alcohol. But there's a whole bunch of different ones. The most common one and the most active one is alpha tocopherol, which is shown here. And again, this is another one of our isoprenoids. So you see those methyl groups sticking out. That's a good sign that you have an isoprene unit in here. Vitamin E is an excellent antioxidant, and it's used in skin lotions because of that, because it often protects the skin against free radical damage from the sun. Most of the sources of vitamin E are from cooking oils because that's where they are stored. Things with higher concentrations of fats tend to have higher concentrations of vitamin E. So you may see things like olives and avocados and nuts are very common sources of vitamin E. We also see it found in eggs and in spinach, carrots, and other such things. But mostly with the higher the fat concentration, the higher the vitamin E concentration. Some signs of vitamin E deficiency are slow tissue healing, which is why it's used for creams when you have a scar to stop from scarring, dry hair, loss of hair, gastrointestinal diseases, lots of stomach aches, leg cramps, and muscular weakness. An overdose of vitamin E can cause rashes, an increased risk in stroke, and sometimes affects the brain, causing double vision, headache, fatigue, and nausea because of those effects. Similar to having too little vitamin E, it will often cause muscle weakness and gastrointestinal distress. There are two major forms of vitamin K. There's vitamin K1 and vitamin K2, and they're very similar to each other. And in our body, we make vitamin K2 from vitamin K1. These are both terpenoids, which again means that they're going to have that methyl group sticking off every fourth carbon. And so you can see that methyl sticking out here, and you can count around and find the terpene. Vitamin K1 is especially found in leafy greens, in Brussels sprouts, asparagus, cabbage, avocado, kiwi, and grapes. It's particularly found in the fats of these things because, again, the vitamin Ks are fat soluble. Vitamin K2 is found in higher concentrations in cheeses, chicken, beef, and any fermented foods like sauerkraut. Both of them are found a lot in nuts. Vitamin K is known to be good for the brain, the heart, the bones, and as an anti-inflammatory. Some of the signs of a deficiency in vitamin K are easy bruising, oozing from the nose or gums, and lots of blood issues. So too much bleeding in many different ways. Vitamin K toxicity is extremely rare. I believe there's only one known case of it, and that was caused by taking too many vitamin supplements. The biggest problem with vitamin K toxicity is that if you are taking a blood thinner, it could become a problem. So you don't want to have too much vitamin K in your body if you're in need of a blood thinner. It does cause excessive blood clotting. And vitamin K toxicity can cause jaundice, which is the yellowing of the skin and eyes, which is caused by an excess of bilirubin, a breakdown product of red blood cells. As a reminder, for the exam, what you need to know about the fat-soluble vitamins are they are a class of lipid, and that they are fat-soluble, and that they are vitamins. That means you don't have to worry about the sources, what happens if you're deficient, or if you have an excess of any of those fat-soluble vitamins. You should know that these are one of the classes of lipids, and that they are fat-soluble, and of course that they're vitamins. That's it.